Barrett esophagus is a pre-malignant condition in which the stratified squamous epithelium of esophagus is replaced by metaplastic columnar epithelium with goblet cell. What actually happened in Barrett esophagus? Under normal circumstances, the esophagus consists of stratified squamous epithelium, while the stomach consists of columnar epithelium. And this specific epithelium is adopted according to the specific function of esophagus and stomach. As the esophagus has to pass the food bolus, so the stratified squamous epithelium gives strength to the esophagus, while the columnar epithelium of the stomach help to protect the stomach from acidic environment. So whenever a patient have a chronic GERD, in GERD there is a reflex back of a gastric content from stomach to the esophagus, and the gastric content is acidic. So due to the prolonged acidic environment in the lower esophagus, the esophagus will adapt itself to the acidic environment. In this adaptation process, the stratified squamous epithelium of esophagus will change itself into columnar epithelium with goblet cell, and this is called as a Barrett esophagus. To diagnose the Barrett esophagus, we have to perform the endoscopy. The endoscopy is the investigation of choice in which we will take biopsy and we will study the biopsy specimen, which will show the metaplasia, the change of stratified squamous epithelium to the columnar epithelium with goblet cell. As the Barrett esophagus is a pre-malignant condition, means that it increases the risk of adenocarcinoma of esophagus. So question arises that how we will manage the Barrett esophagus. The management will depend on the biopsy, that what kind of pathological process is going on in lower esophagus. There are usually three types of biopsy report, and management depend on the type of change in the epithelium. The first one is Barrett metaplasia without dysplasia, mean that there is metaplasia, the epithelium has changed, but there is no dysplasia. In this case, we have to treat the patient with high dose PPI, and endoscopy should be performed every 3 to 5 years to look for low or high grade dysplasia or adenocarcinoma. The second one is the low grade dysplasia. If the biopsy shows the low grade dysplasia, then we have to treat the patient with high dose PPI, and the endoscopic surveillance should be done every 6 to 12 months to look for the high grade dysplasia or cancer. And the last one is a high grade dysplasia. In this patient, the endoscopy should be performed every 3 months to look for the change of the dysplasia into the cancer. And the ideal treatment of choice for this type of Barrett esophagus is high dose PPI with endoscopic ablation and resection. So it was all about the Barrett esophagus.